We know the coronavirus is causing a profound impact on all of our lives, and we are committed to helping you get the answers you need as we try to rebound from this pandemic. COVID-19 has changed the way we communicate, so it may be tough to identify when a friend or loved one is going through a difficult time. Reporter Ruta Olsenaida has more on how to approach these conversations, especially since May is also Mental Health Awareness Month in today's edition of the Rebound Heartland.
COVID-19 has put a strain on the entire nation's mental health. Calls to the Disaster Distress Helpline were up over 300% in March of this year compared to February of this year.
People think, well, we just don't think about it. We don't have to think about it and everything will be okay. But that can be very dangerous.
Talking about the mental health problems we may be experiencing is important, especially right now.
Staying connected as much as we can, even if it's different, can again identify challenges, but just keep things and spirits up as much as possible.
But finding the opportunities to do so is now harder than ever due to social distancing, activity cancellations, and school closings.
Driving and chatting with your loved ones is a great way to connect and chat. But when less of us are driving on the roads and more of us are stuck at home, it may be time to get creative.
I encourage parents to be observant.
Now is the time to take the lead on those difficult conversations in any way we can.
If you're calling somebody and you're just like, oh my gosh, this world is it's so different, and I had kind of a bad day today, and so I just really needed to hear your voice, and I really want to know how you're doing.
Being the first to reach out to a friend or loved one to see how they're handling things is a big step. Signs that they may be going through something more serious include having withdrawals or isolation, experiencing mood changes and agitation, or having a hopeless world outlook. Their personality might have changed, or you may have noticed a change in personal care or exercise.
And if you notice that, I think it's important that we ask a person, I've noticed that you're not as active as you used to be. Are you doing okay?
Even though you may not be able to check up in person, make the effort to do it in other ways.
Let's say you used to call your mother or your grandmother once a week. Make it more frequent.
Sometimes just talking can be the best help, but if someone you know is going through something more serious, call a helpline or suggest professional help. Reporting in Omaha, Ruta Olsenaida, 3 News Now.
Earlier today on Facebook, we asked, are you comfortable opening up about anxiety you may be experiencing during the pandemic? 72% have answered yes, 28% have answered no. For mental health resources and hotline numbers, visit our website, 3newsnow.com.